There we go. All right. Hello, everybody, and welcome back. Oh my gosh, I think this is week 12 that we have been gathering. Holy cow, time is like flying by. And I don't know about you, but I still, every Friday is like, oh yeah, we get to see everybody again. I'm so excited. So I'm really glad that you come back every week. I really appreciate it. So open up your chat box because that's a way that we can stay connected throughout the call, and be sure to say hello to people and welcome them. I won't have a lot of my teammates joining today because a lot of us all took the week off. So I'm a little bit on my own today, but that is good. I think we have some really good questions that we're going to kind of start off with today. But I am open, and we are open to whatever you guys need, because this is all about you and what you most need out of this hour today that'll make it time well spent for you. So if you have topics or something you want to bring up, you are welcome to unmute yourself, which you can do by going to the bottom of your Zoom window and over to the left, and there's a little microphone there that you can click and unclick to mute and unmute yourself. If you have a webcam, turn it on because we would love to see your faces. It makes it so much more fun. And we can get going. So I love all these people are coming on. Yay! All right. So we had a couple questions. One was like, how are you optimizing communication with your care partner team right now? Because boy, communication is super important. So what are some successful best practices? From your perspective, we want to bring the question back about the organization's culture. So if you think back into January and February and kind of like, what did you value and kind of what was driving the way your organization operated back then versus now? You know, did it help you get to where you are today? Did it hinder you? What was that like for you? How are you fighting off the dragon, the institutional creep? And then someone had suggested that we kind of talk about an Eden alternative principle every time we meet, which I thought was another great idea. So I've kind of picked principle 7 to talk about a little bit because like maybe that's timely. And so that's kind of where all the different places we could go with the conversation. Does anyone have a preference as to kind of like where we start the conversation today? Okay, hearing none. I will start. So, so let's start with principle number 7. So principle number 7 of the Eden Alternative out of 10, there's 10 principles, is all about the idea that medical treatment should be the servant of genuine human caring, never its master. And it's a really interesting, I'm a pharmacist by profession, so I have to tell you this is one of my favorite principles. It's one of what we call our practice principles. So it's about really thinking about how we operate and how we go about the business of being a care partner with someone else, and how the idea that medical treatment, while I love medical treatment, oh my gosh, blows your mind how awesome medical treatment is and everything it has and the longevity it's providing for people and all these great things that it does. It is not the star of the show. It's there to help people be their best and to continue to grow and continue to be all that they can be every single day. But it's not the star of the show. And sometimes the doctors and the nurses and the pharmacists can think it's all about them, but it isn't. It's really about the elders, and it's about our relationship and how we care for one another and we help each other to grow. So that's really about principle number 7 is about putting the balance back in there. Yes, medical treatment is very important, but it is the servant of genuine human caring. It's more important that we genuinely care for one another first, and that involves creating relationships and really seeing and hearing and knowing each other. And then the treatment can do what it does best. So I know as a pharmacist, that was pretty life-changing for me to really kind of shift all the training that I had in school. So Evie, go ahead.
So I think one of the fundamental problems is that the system is designed for medical treatment to be the master. And no matter what, it is much faster to treat the symptom, write a prescription, do some procedure, rather than help people, as I talked about in the Eden moment, where people take responsibility for their own lives. I mean, as a gerontological nurse for 40 some odd years, I have seen nothing but problems because of the medical model. I've seen the good things that medicine does, of course, in acute situations, but the danger is the system is designed for precisely medications and treatment to be the master.
I see a lot of heads nodding. Go, Star.
I've got a little bit of a heavy heart today. So I don't want to infect you all with my heaviness, but I've seen something happen that I really feel like, okay, this is not a good thing. We have an elder that was working on her 100-year birthday this August, but without having her family close by her, and I'm talking this family was close-knit, very, very close. And they were here multiple times a day. And fortunately, one of them had started working for us before all of this lockdown and everything. And so she was able to come, but this lady, it was so different for her. She didn't catch a bug, she didn't have COVID, but she just could not thrive in this environment. No matter what we tried to do, we could not take the place of the family. So the whole idea of Principle 7, I agree with you, Denise. I love that principle because I do think that's where the big problem is. I mean, this is a good example because, yes, we're keeping the elders safe, but at what cost? And that's where my head's trying to wrap around this. Like, I don't know what the right way to handle this is. I've been listening. I listened to an epidemiologist yesterday, and he was talking about the fact that, we just need to let everyone out that's not in the age category that is at high risk. So I'm going, oh, great. That means they're going to lock all of us down for how long? So that's kind of what I've got going on in my head this morning is, yes, we want to take away that medical model, but when we have something like this come to camp with us, how do we do that and not, have people think we're taking too high a risk with people who are in a vulnerable age group? And we've followed what the health department has told us to the T, but it doesn't feel right. I don't like it. I know it's not the right thing, but I've seen this coming. The whole infection preventionist. We're now told we have to have an RN full-time infection preventionist. That frightens me because I worry that we are going to lose sight. So I'm going to have to work harder to get Principle 7 out there and make sure that our people understand that we're different. We get told that all the time. We get told, oh, I've never been to a nursing home like this. So I know we're on the right track, but this thing has put us off track as far as I'm concerned. I don't like the feeling. If anybody has any thoughts in your head, we have a very interesting health department. They have been very just right down the line, this is what you have to do. And if we don't do it, then if something were to happen that was bad, it would be all on us. So anyway, that's where my heart is today. I love seeing you all, and I hope that you can take my heaviness and turn it light by the words you say.
Yeah, get out in the chat box because you're getting a lot of, we're here for you to support you. Yeah, you're getting a lot of head nods. People are feeling, yeah, I can sense it. Yeah, go ahead.
Well, I think Star, you're a beautiful soul, and relationship is the heart of this principle, and we haven't had that in medicine because medicine became reactive. You come in, you give a complaint, the doctor thinks about it quickly, gives you a cure, and you're out of there. And the old thing of having a relationship with a doctor has gone away. We have a unique opportunity, though, now with all that's happening with this crisis to really make a breakthrough, because we do have one model that's working pretty well, but that model is limited only to indigent people who might otherwise be in a nursing home. And that is the PACE program, the program of all-inclusive care for the elderly, in which geriatricians form actual relationships with people who come to a center. And the idea is to try to keep people living in their own homes. And because it's relational, they've been able to make, those programs have turned out to be very lucrative. So not only do they provide better care, but they do it for much lower costs, because by having a relationship, the physician is able to really meet the human needs and without the extraordinary things to prolong life. Because what good is it to put a feeding tube into a person to prolong their life by 2 or 3 weeks? But that's an expensive procedure, and it's life. It's just, well, I just don't think it's always called for. And we have a lot of suffering going on. Now, the nursing home model really, in its current form, dates from 1965, the Great Society. And we all know that it doesn't lend itself to social distancing. And so that's problematic because semi-private room became the norm. And that's hardly social distancing to share your life with a stranger. So if we bring these family members in, they would, already we have a challenge because our employees are coming in, and because we have high staffing ratios, the percentage, the statistical exposure to the threat of the virus goes way up, and we don't want to be bringing about the premature passing of people who are still cognitive. There are people for whom that might be a blessing, but for most of the people who we know who are living in nursing homes, they want to continue to have some kind of an existence. And I think we don't want to do anything that would jeopardize that. There are things we can do. The Alexa, the Amazon Echo Show, for example, with its drop-in feature, Independent has a similar thing, can allow people to connect with families, much as we're doing here, and that can be meaningful. But a lot of communities, a lot of nursing homes will not allow those devices in their home because they're afraid that staff might be recorded by the remote listeners saying something that could give them HIPAA liability. So unless we really rethink this whole model of end-of-life care for people and turn it inside out, we have a problem here. And I think this goes to the heart of it. Now, the hope comes with telemedicine, because telemedicine allows, particularly because in a nursing home, you have staff, so they can work with that remote physician to up the level of the care. They can deploy an otoscope, for example, for an ear examination that would be hard for people to do just on their own. So there are some positive things that can come out of the collective living environment if we do things like create negative air pressure in the room and really do take seriously this contagion control. I think the idea that it's purely amount of staffing ratios is totally misguided. It may serve the special interests of certain people but there are a lot of technologies which are beginning to come about that can let us do a better job if we but have the innovative spirit to move ourselves forward and to give us a better standard so that when we reach that point, when we're there and we're the ones who need the help, our lives are preserved, we have meaning, and we're allowed to have connection with those we love. And those things can be brought about. We have to encourage it and not discourage it.
Yeah. Thank you, Jack. Yeah, that's the idea of Principle 7. How do we bring genuine human caring back into the forefront? Treatment's really good, but it's backstage, doing the things it needs to do to support that genuine human caring. So lots of great stuff popping up in the box about what's going on. And I know that we could easily spend the next 45 minutes talking about everything that's wrong with the current medical health system. I have no doubt everybody has opinions about that. I do want to let you know about a book that I read, and I've met the author, who is this brilliant man, Vivian Telesnayak. If you've ever heard of him, he's awesome. He wrote a book called The Return of Compassion to Healthcare. And it's a really great explanation of how the healthcare system went from what it used to be 100 years or more ago to where it is today, and how to get back more toward where compassion leads the way instead of becoming this afterthought. And so if you want some ideas and just some innovative thinking about that, I would highly recommend the book. It was brilliantly written. He's a brilliant guy. So just really kind of cool. But yeah, genuine human caring. Ashley, you're saying genuine human caring is a basic human need, is it not? Anybody disagree with that? Yeah. So where are you seeing genuine human caring being the master? What examples are coming to life for you guys? And Star, there's some good stuff in the box for you too.
Well, I mentioned the PACE program. I think those PACE programs have proven to be excellent, but they're restricted. They seem to have encountered political headwinds that I don't fully understand. I think because they're funded by Medicaid dollars. They're restricted to the indigent, and they're only for people who have reached the highest level of frailty. And that's unfortunate, because I think everybody of every age and every socioeconomic group would benefit from a PACE concept of interaction and relationship medicine instead of reactive medicine.
Yep. Anybody, any examples of where you're seeing genuine human caring really take the forefront?
So my wife is actually a primary care physician, and she works in a federally designated health center. And it's another example, as Jack was saying, where this is really a government-sponsored program, which is limited to Medicare, Medicaid, and the non-insured. But the principles that are that have been put in place in terms of measuring outcomes rather than procedures, patient-centered care, they are putting that in place. I mean, I see that every day. She comes home and she works another 2 hours calling back the patients, like giving them test results, talking to the daughter, the granddaughter, the niece, the uncle, trying to making sure they understand what they need to do. And they don't have a profit motive, because the reimbursement is so small anyway. They're part of a hospital, and they're always losing money. So the best thing they can do to save money is actually make sure the patients stay healthy, so that they don't need interventions. So there's alignment of goals and means in this case. But I agree with you that there are so many problems with the current healthcare system. the fact that it's so fractioned make it impossible to follow up on an individual patient and so on and so forth. But there's definitely about nursing home a design issue. I think technology, as Jack pointed out, is certainly has changed since the nursing homes were first put in place. But even the whole concept of, and I think we've discussed that in prior weeks, where where this is to build the community, bring people together, blah blah blah. So of course, there's nothing in there that is actually already in place to prevent infections, other than isolating people in their room, which cause just as much trouble as good, as we all know, and then creates the staffing crisis because they're not set up to do it that way. So I think education, which is what you are doing, should be pushed for the people who make the decisions about the care, which are the caregivers and the families. How do we reach out to all these people? And maybe, I run a home care agency. I think, like I can see how I'm going to be now sending out information about your philosophy and principles to all the people who care. But these are the people who end up making the decisions for the people in the nursing home. So, and of course, I don't mean to minimize the role that individuals play. I mean, we have elders, who are very much capable of taking care of themselves. But, we're always talking about placing the elderly, about the, they don't want to go, how do we make them go? And so, there's, I think, education. How can we push our principles and also work on the design of not only the facilities, but the systems in the nursing homes? That we can do. We can't wait for government reform, which has tried and has not succeeded so far.
Thank you. Wow.
So here at Denali Center, we've been kind of stabilized as far as COVID goes. So we've been able to try to really work through it all. And part of our strategic planning for the year, which we got to come back to, was to incorporate more Eden. And so we got a grant to do Eden Associate training for more people, which is all put on hold now. So we had to figure out how to incorporate Eden with our strategic planning and do that. And one of the things is just to keep it in the forefront. Because Principle 7 and fighting the medical treatment being in the master is a constant daily battle. And so what we've been doing lately is we have weekly meetings with each neighborhood, so 4 meetings a week. And at the beginning of each meeting, we're asking them for an Eden moment and having them really think about what's going good, what's happening and what's something wonderful to share. And then at the end of the week, we have a new CNA lead mentor who's putting together a email and putting all of those Eden moments into the email, and just bringing those things to the forefront so that it's it's that positive light that you want to search for and you want to keep going on. And so creating the small moments, and hopefully that's going to make the big moments happen, but we're just keeping on pushing.
So anything enlightening that's come from those meetings? I love that you're getting people engaged in the conversation.
What do you think? I don't know. Well, and the other thing too is just having these weekly meetings, and then we're sharing it with our leadership group. So right now in the room, there's like 12 people, just getting this information. And it's been really encouraging because knowing that we're all facing the similar situations, and in different states, it's different ways. I think that's been really powerful for us. But it's also been something to be able to pull us together too, just having this time. Just learning different things. We have a young lady who had a traumatic brain injury who's a couple of years ago, and staff have really worked with her and like socializing with her and having a good time. And they just recently got her off of tube feeding, and she's eating solid food now, which is huge. And she's talking. We got a cat for her, and she's starting to move her hands because of the cat. it's just been, that's been probably one of our biggest successes that we've had here recently. Yeah.
Very nice. Very nice. Very nice. Evie, go ahead. Thank you, Ruth. Thank you.
So I used to consult in a home in Colorado that would send some residents to the Eden Associate trainings. And then the residents would take charge of the community meetings that they had, sometimes every day, sometimes 4 times a week or whatever. And what happened is the elders became very involved and very empowered. They actually owned the home. I mean, because of those meetings and because they came to us Eden Associate training, there was now a depth of relationship forming, a depth of empowerment with the staff and the elders. And really, it was one of the most exciting homes to go into. So moving forward, keep that in mind, because your elders really can drive this. And one of them would hold an Eden meeting every week and go through a different principle every week and then post it around. This is the elders, post it around the home, and then they would have discussions. So this is one way of really keeping Principle 7 and all the other principles alive.
Very nice. And Angie, you said you've got, thank you, Evie. Angie, you said you've got somebody actually doing an Eden Associate training. Oh my gosh, face-to-face training. How on earth is that going to work in our next normal?
Well, you know, we have that happening in Kentucky this week. So Ryan, actually, he leads all of our education down there. So Ryan, do you want to talk about how they're pulling that off, or?
Sure, I'll be glad to. So yeah, we got a phone call from their administrator there saying, we want this training and we want it right now. So we made it happen, talking with Meredith, and we've got the social distance guidelines that, you know, she had sent out for us, but Ronnie Anderson's actually teaching the class. And so it's a great situation. It's a small group that already works together anyway. So they're already, you know, face to face. They know each other well. They did do the training off-site, and you know, they're practicing all of the physical distance guidelines, but Ronnie says it's going great and everybody's really glad to have the training. So I think that really puts that energy back in that home and excitement, saying, you know, yes, we can move forward. So absolutely love that it's going on.
Nice, nice. Okay.
And I just want to say too, like, we have to figure out how to push through this thing. And so for us at Signature, this is, you know, the Eden Alternative is a close partner that we've aligned with for over 10 years. And moving through, giving people more education that need it. This home had started working to get on the Eden registry. It's one of our homes that is not on the registry yet. And they really want their tree, and so to get their tree they need to accomplish these things, because that's the path. And so they're like, yeah, we're just gonna go for it. And so I really admire their courage. It's been really inspiring to me to see people like, let's just go after it, right? Let's go after what we feel like our elders need and what our stakeholders need. So yeah, I would tell everybody, figure out how to push through to get what you guys need in your communities, because that's the bit of sanity that you have in all of this. There are things that we can't control, and we can't focus on those things, right? Because it will drive us crazy. There are things that we can control that are within our realm, you know, and how we move through relationships, how we promote relationship depth and building in each of our communities. Those are some of the things we can control. We can figure out how to do that, right? We don't know what's going to happen outside of that, but how we react to all of those things are all things within our control. And so we have to, I've been so inspired by just the resilience of our teams and really just people around the world, and how that's happened over the last 3 months. The creativity is amazing. And I mean, this is a time to really exercise that creative muscle, right? And to exercise that with our elders, giving them space to really making sure that people are able to process what's been going on, because that's the most important place where we're at right now in this journey, is how are we giving people the opportunity through support groups, virtual support groups, all of those ways to process what's happened in our homes, because it's very traumatic. And when you're in the midst of it, you don't feel that trauma. But afterwards, that's when you wake up and you're like, what did I just go through, or what just happened? And so that's really important to focus on, I think, on this principle 7 and just the relationship death, Denise.
Thank you. Thank you. Yeah. And I love what you said. We can still push forward. What can we control? What can we do differently? Which is one of the reasons I like principle 7, is because like treatment is always going to be needed. This kind of stuff's always going to happen. But how do we do it in a way that puts the person first, that puts our need to care for one another, to help each other be our best and grow every day? So I love that a community said, hey, no more, we're doing the training. We need it. This is the time. We need to have people be enlightened. We heard the same thing we had an online class in the midst of operating when this all hit. And they asked the participants, they said, do you want to keep going with the class every week, 90 minutes, or do you want to let it go and we'll pick it back up when things quiet down? They're like, oh no, we need this now. So they stuck with the class and they graduated, and they took a lot of good stuff away that helped them put genuine human caring ahead of treatment. And it worked for them. And it was really good. So anybody else examples of where you see that genuine human caring really surfacing in all kinds of really neat ways? I hear about it every week on this call. Star, how did it work? Didn't you have a family member that you said was essential and you were able to bring them in to help an elder with her meals? How did that work?
Yes, and we did bring her in. It didn't really help. The person still was just not able to focus on the meal, and it just, you know, she's at a stage where she's very short attention span, just not really able to connect with what needs to happen when it needs to happen. And so we're just offering lots of finger foods frequently, just doing our very best, but it's a very difficult situation. You know, we've had several family members who've actually come on board with us. But one of the things is all of our people have to be COVID tested. And up until, I mean, last week was probably the worst COVID test I've had thus far. But now they've decided that we're going to do our own testing. So we're waiting to get the testing because we do that on Monday. And it's just a swab you put in your nostril. But I mean, last week I felt like they were going to China or something with that swab. And they also did one in your mouth and tickled the back of your throat till you went, and so anyway, yeah, unfortunately, us having that person be essential didn't change a whole lot, but she at least got to see her mom, and that was a good thing. And I just will be so happy when we don't have quite the restrictive visitation in place. And, you know, there's all sorts of wonderful things that I see, but getting our health department to approve those things is monumental.
Okay.
So,
Thank you.
Star, I wonder, if, you know, some people simply become life weary at some point. And this happened with my mother. My mother had a stroke, and she spent 12 years in a nursing home. And finally her funds ran out. So she was on Medicaid, and on Medicaid, they wouldn't do her hair. So that was sort of, for her, she had lost all her dignity. So she no longer wanted to continue to live. So she simply stopped eating and drinking. And I think that's a very common occurrence among the very ill. My mother was, I think she was 96, as I recall at the time. but she simply was life weary. She couldn't read her books anymore. There was just, her life was, she was totally dependent on others. That was difficult for her. And I think many residents, all of us who are my age, know that you can end it pretty quickly just by ceasing eating and drinking. And then some people may try to force you. So my niece came in when my mother was taking her life and tried to force some food in her, and my mother's bony hand came out from under the covers and with great force pushed her away because she was ready to go, and she did go. And then the death certificate just read failure to thrive. I think that failure to thrive is often used to cover these end-of-life suicides that may not be an irrational choice. You know, whether that, you know, should that be a person's choice or not? If they're sure it's driven by a kind of depression, and we don't want people to be governed by irrational depression. But these are very deep human questions, and our very evolutionary nature wants to deny death. We have whole religions devoted to denying the realities of death. And yet death is a reality. And I think that as people approach life's end, they're aware of that and they're ready to accept it. My friend Glenn Quillen, who was 103, he was notable because he was the machinist who crafted the atom bomb. And he had a spinal fraction, so he was in great pain, and he wanted to end his life. And so the ceasing eating and drinking, some institutions I understand won't allow that, but I think most will provide palliation and assist people. So these are very, very deep questions that we're dealing with here. And I'm not sure how that would fall under this precept that we're discussing. But this idea of people who are just life weary, that's a big area.
Go, Chris. And then Evie, I think, wants to talk.
Yeah, I'm gonna be a little star here for a minute. I wasn't gonna bring this up, but this week on Monday, a friend of mine, not close, but we've hung out for sure. She took her own life, and she's younger than me. She's in her she's probably about 40. So her mother had died about a little over a year ago, and her mother were so tight. They did everything together, and she just could not get over that. She had such a hard time getting over that. And myself and some other friends, you know, we reach out to her periodically, but I can't help but think what this isolation has done to her. She lives alone. I know she was working from home, right? In this last month, she has not been responding to people's texts, but you know, hey, that just happens, right? We all get busy and things like that, thinking, you know, maybe she's just getting it together. But when we talk about this, and Jack, what you're saying about life weary and depression, and I think you add this isolation on top of it, it has brought home to me even more about the Eden principles and feeling lonely and helpless and bored. But that human connection, which we talk about in principle number 7, I know she was getting treatment for depression, but she didn't even want, like we talk about technology and Zoom calls and social connections. You know, she's been invited. She didn't want to come, right? And then you add this kind of isolation on top of it. And I don't know. I just can't help but wonder if COVID wasn't here and she wasn't alone, would things be different? So it's just really brought this idea of isolation to a head for me. So thanks for letting me share. You know, we weren't besties, but we definitely hung in the same circles, and you know, it's tough. I don't know, being alone. So
sorry for your loss.
Yeah, that's okay.
Yeah.
It's out of my control for sure. You know, that's a choice. That's a choice. Yeah.
So
real quick. We're in a particularly difficult time. I mean, is, you're right, that it's pretty depressing just to have this contagion unleashed on the world. And we're not sure whether we're entering a new era in which there'll be this kind of contagion cascading forward, because we've been such a fortunate generation to have experienced longevity and antibiotics and all of that. And the generations before us all had to deal with their mortality much younger than we have. And now we don't know. But having that, and then having on top of it this sadness that comes, this unbearable sadness coming out of the collapse of authority in Minneapolis. I just don't know how we can bear this. We need some kind of leadership that can bring us some kind of hope, and perhaps it can come from those churches.
Yeah, yeah. The world is in need of genuine human caring right now. We all are. We all are. And it is hard when we need to stay distant and yet socially connect. So I get that. I loved, Kathy Lieblich, you said the health department needs education. So I'm going to just put a brief plug in here and say that state surveyors, government workers that work in healthcare, that kind of stuff, they can come through our Eden Associate training at a nominal cost and be educated. And I loved it when we educated the leaders of our health department in Nebraska and stuff and got them engaged. And guess what? They want exactly what we want. They're human. They understand it. Thank you, Kathy. Go ahead.
Great to know. Just that's great, Denise. I agree that we need that education needs to happen for all those stakeholders.
Yeah, they may just not understand the possibilities and yet want them. But we kicked it off with like the medical thing is easier. Evie, you were saying the medical treatment side of it is easier to bill for, measure, monitor than the heart. You know, if we could all be like that, what's the movie Grinch, where he has a little x-ray machine and you can see his heart enlarge as he gets more into the caring part of it. It's like, if only we could do that and measure it that way, that would be so awesome. Yeah, so Evie says the best surveyors in Colorado are the ones that came to our training. Absolutely, absolutely. I've really enjoyed training surveyors over the years. So if you have somebody and you've got access, and our training may be one right answer. Go, Evie.
If I can share a great story, I had one of the meanest surveyors on the planet in one of my Eden classes. And I went over to her. She was kind of this hippie looking woman, so I connected with her. And I went to her and I said, like, I really like your energy. Like, I really like you. Like, what's the deal? You're like the worst surveyor, the meanest surveyor on the planet, from what I hear. And I could do that because I was a consultant, so I could get away with that kind of stuff. And she says, well, I used to be worse, but I love the elders so much that I want the best for them. But after the 3 days of training, she put up her hand, she stood up, and she says, I want you all to know I have learned so much from all of you over these 3 days. I promise you, I will be the best surveyor you have ever seen. And until she left the survey department, she was. It was so powerful.
Very nice. Very nice. Very nice. All right. Anybody else? Where have you seen genuine human caring kind of rise to the surface?
Hey, I think we should think about our volunteers too. So we have seen a large influx of volunteers, and I think that really showcases how the community wants to, become more involved. And we've seen a lot of volunteers that call and actually register, come through our volunteer registration link and register as a volunteer. And so what we've got them doing is they'll come do tic-tac-toe or some kind of things on the windows with the elders and engage them that way. We set people up for one-on-one video calls. So as we know, all of us know that not everybody has a family member or a friend who can call them video call, right? So it's been a really great way to connect people back to the community in a time when you wouldn't think that you would have that. So I think people are naturally searching for a way to help. And that our duty is, how do we help navigate that? How do we help them find a way where they can serve and have purpose that really helps helps us and helps our elders to have, stronger relationships with people outside of the people they're seeing every single day. So just think about it, what you can do in that realm. I think you'll be surprised.
Very nice. Yeah, I keep thinking, there's elders like Jack was saying, the PACE program, Pascal's with the home health care. It's like there's so many elders living in their own homes and feeling isolated. And then you've got elders in nursing homes who are feeling like they're just like really, and like, wouldn't it be cool if there was some sort of dating service where you could partner people up? So I learned a couple weeks ago, we had Life Bio and Beth Sanders on a Facebook Live thing, and Life Bio, and you can Google them, has created a My Hello line, I think is what they call it. And you can let them know that you would love to have somebody regularly call you, and they use the phone, regularly call you, and they pair you up with somebody of similar interests. And it could be somebody anywhere, not somebody even within your own community, be somebody several states away. But they start pairing people up, and it's like, oh my gosh, could we make that happen at local levels and pair up people who are struggling a little bit in different ways? Even high school kids, it doesn't have to be people of the same age. It could be people of different ages. I mean, the kids are having the same struggles that everybody else is having. It's a humanity issue. It's not an age issue. But yeah, I think about, how could we help facilitate some of those conversations? Has anyone heard of Big and Minis? It's students connecting with elders all over states. Linda, I've never heard of that. Can you unmute and tell us more?
Yes, hi. I heard of them through my husband, actually, who is a professor in the university system in Georgia. And it's incredible. I did reach out, but they're students who actually have a desire to work with elders, and they do the vetting and everything, but what they do is they connect the students with an elder all over the nation, and they will, learn. They'll just talk to them. They'll call them up, they'll FaceTime, they'll do whatever communication works best for them, and they set up certain times, and it's all free. Really excited to hear about it. I can shoot over the information, but it's Big and Minis. I think it's bigandminis.com, but they're gaining national recognition as well.
Very cool.
Shoot that over.
Thank you. That would be lovely. Yeah, we'll make sure that gets in the chat so everybody can look for
Okay.
that. Neil Ann.
Yeah, Denise, when you asked that question about Principle 7, putting personal relationship importance, and you asked that question, it takes me about 3 minutes to finally process, and finally then 10 minutes later, I get brave enough to answer. But I really appreciate the roommate that I have that is the 97-year-old. And she is going into accelerated decline with this isolation. But it's like she has a son-in-law that is a nurse practitioner. And that family asks the right questions, gets in touch with the people here, like STAR's administrator and director of nurses, and they brought in immediately, like it's gone on for about 10 days, but we all hoped she'd pull out of it. Well, they sent the family, and what was really interesting is that in the dialogue, he knew exactly how to rouse her, and politics was a major way of getting a reaction. So he said, now, who are you voting for? Now, and it really, well, you gotta be kidding. I'm not gonna avoid, she really came back. And it's just like, see, the family knows the buttons to push. And it brought life. And he kept pushing water. He said, now look, we bought you these two. One's for morning, one's for afternoon. And she said, I know. It was like he knew the buttons. And I just, it's human love. And if the administrators here and all didn't encourage it, she would continue to be declining. So that's my little note. But thank God for you guys on Eden. You really know how to bring life. You know, I believe strongly that Moses went up into the mountain and he laid down and died. And I believe that we all should do it that way, you know. So I guess that's the hope for us all. Anyway, thanks. Bye-bye.
Thank you, Nellie. Thank you. I love, Kathy, you said one difference between an elder who's living in their own home with care, being coming in a family and or a paid care partner, and an elder living in a nursing home is that the person living in their own home has choice about going outside and hanging out with family in the yard and that kind of stuff. And it does get harder when you are in a bigger environment, when you have fewer people that can assist you to get out if you need to get out. And even Star, you said even in yours, people can't come onto the grounds, which is just really interesting. Does that mean they couldn't like sit out in the street?
We've actually had, and Neil Ann had some visitors who were on the sidewalk, and she was on the side of our building on the grassy area. The only thing we have to be careful with to be following our rules completely is we can't have people come off of the public sidewalk. They have to stay on the public sidewalk and then they can visit. It's a distance, but it's, you know, it's the best we've been able to do. We've actually had a lady be able to go out on the front porch, and her daughter just lives across the street from us. So imagine how difficult that must be, because your mom is so close, but you've been told, no, you cannot enter the property. So she stands on the public sidewalk in front of our building and they talk on their phones together. So that's the way we've managed that. So we have had some visitation, but some of our people just, the distance is too far. It almost is more frustrating to them than helpful. So you just have to know where the person is and what's going to work for them. Sometimes Zoom doesn't work either. Some people just can't connect with the whole idea of Zoom. But you've got to try to make it work, and hopefully one of the things will be the avenue where they can connect and have some semblance of visitation and closeness.
Yeah, 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 very cool. So Linda, thank you. Linda put the Big and Mini website into the chat box. And I love what she says. She says, the world has stopped moving. Everyone is staying home. It all feels upside down. By creating beautiful, mutually beneficial, generation-spanning friendships through phone and video calls, we believe that we can help people feel just a little bit better. So that's very cool. Have you heard about Teen Years? Albuquerque-based program which hires teenagers to teach elders how to use technology. Ah, Pascal, that's pretty cool. I have not heard that.
So I believe they're not for profit as well. So I heard the presentation on NPR actually about them. So I contacted them, and just as the pandemic broke out, I was in a conversation with a program in New Jersey that's called Westwood for All Ages. It's one of like 9 age-friendly communities in New Jersey, which are sponsored by a big pharmaceutical company, so, or chemical. I mean, so there's some goodwill there. And they have now applied for a grant to start also a similar program. But the testimonies were really unbelievable. Like one of them, of course, maybe not applying to everybody, but was this woman who had immigrated from Africa, and she had a cell phone, but she didn't know how to use, the technology. So they showed her how to use WhatsApp, and then she was able to talk to her family basically every day for pennies, right? And so that is a great concept, and I wish we had that off the ground before the pandemic, because it would certainly have been welcome during that time.
Mm. So that's one of those, as soon as like things calm down, that's coming in, it sounds like.
Yes.
Yeah. Yeah, it's amazing all the resources that probably were outside of our realm of view until like other things happened, and now it's like, whoo, we are laser focused on them. It's pretty interesting how that has shifted. So Brad says, oh, Brad, do you want to share what you posted in the chat box?
Yes, hi. We're a CCRC, a life plan community, and we only today began allowing window visits in our healthcare community with folks who either have a spouse or who have a family member in one of the other levels of care here. And we have, actually, I think they just celebrated their 65th wedding anniversary. But I was blessed with the opportunity to watch their first visit this morning, and this is after they had been Skyping and FaceTiming, but I mean, I think we can all agree it's just not the same. I felt blessed to have been able to share that experience with them. The joy that obviously the husband lives in our independent living community, and the wife lives on our memory care unit. And the tears of joy it was very overwhelming to see the experience. I think we're having to get really creative in terms of how we do honor personhood and how we recognize that and help people maintain that. And I mean, it spoke volumes. I mean, and I have to laugh, Kathy, God bless you. Our departments of health could use some education. I don't know, I know that there's a fine line, and I know we've struggled with those families who want the visitation restrictions lifted, and those who don't for the safety of their loved one. And it's been a real kind of juggling, balancing act. And I think it's important, and again, in the interest of respecting personhood, that we don't, lose sight of that, and the fact that the solution can't do more harm than the problem itself. And I think, this has gone on long enough that I personally believe that we're nearing that. We've tried to be creative. We had an outdoor concert this morning. We had residents open windows. We're doing the best we can, but again, it's becoming a real challenge in terms of how we honor and recognize personhood with the given limitations and restrictions. I also had to laugh. I'm going to share a little bit of our sin. We are right now currently being we're being looked at in terms of a complaint from Department of Health on visitation. And our executive director came to me yesterday and said, Department of Health is asking for the last 3 months of resident council meeting minutes. And I looked at her, and my expression was clearly, you've got to be kidding me. And I said, okay, the last 3 months would be February, January, and December, because by order of the governor, we've not been able to conduct groups, which one of course, would be resident council. We've gotten creative in terms of doing surveys and, taking some things out of the critical element pathways as far as, are your needs getting met, and are staff responsive, and are we doing the best we can? What can we do better? So we've been doing that kind of stuff, but I thought, wow, this is a State Department of Health asking for minutes that they've told us we're not allowed to get.
Yeah.
And so I thought that was a really interesting request. I'm not exactly sure. We have not gotten resolution yet for the outcome of the complaint investigation. I'm not sure exactly. I know it had to do with visitation, but that was all that I had really gotten. So I am curious to see how that turns out. And we'll see. But again, it's a struggle. And I appreciate everything everybody said. And I again submit that I get a lot out of these meetings. I don't always talk so much, but I do get a lot out of them, so I appreciate that. So thank you, everybody, for your input and your insights. It's very much appreciated, and we all, I think, are kind of in the struggle trying to figure it out as we go. It's kind of like they said, we're kind of trying to put the wheel on the bus as the bus travels down the road. And it's been a struggle. So again, thank you everybody for that.
Very nice, very nice. I love your backgrounds. You always have an interesting background going.
Thank you.
I think, Chris, what does Sue Ellen say? Lay the path. Cheryl knows this. Lay the path as we go. Is that what she says all the time?
Walk the path as we lay it. Is that right, Cheryl?
We lay the path as we walk it.
Walk it. Yeah. Okay. There you go. Right. I had it backwards. Yeah. Yeah. Figure it
it
out as we go.
Yeah. Make it up as we go along.
Yeah. There's been a lot of that. Oh my gosh. So Angie says Angie, tell us more about what you're doing with resident council or elder council.
We've done that since the beginning. So we just moved the group meeting to a one-to-one elder council meeting. And so they've created a document to track that. They go individually with the elders and review the previous month's meeting like they would in the group. And all of the things that would happen is just done on a one-to-one basis. And then someone compiles, our quality of life director or social services director compiles all of that information into one document, and then it gets distributed back throughout the community. So I don't know if other people are doing that, but we have still been doing elder council, a modified version in that way, so we don't lose sight of all of those things that we need to discuss at that time.
Okay. And Meredith, just real quick, you want to add anything about what you guys are doing, Meredith Bauman?
We do the same by having a compiled list we give to all of the residents that normally attend a council meeting, plus others. They can write it down, we compile it. One of the things that they asked for, we do a lot of Zoom meetings with staff, and the residents asked that they get to be able to have that same kind of communication from the administrator and other folks that are our management. Our television system allows us to be able to do that throughout the building. And so we are going to do that. And our administrator will share information with the residents instead of it coming in letter and 20 people distributing the letters throughout the building. He will just be able to give a concise, here's what's happening. Here's the state of the nursing home.
Very nice, very nice. Oh my gosh, you guys, it's 12. We're 2 minutes past the hour. Holy cow, this time went really fast. Oh my gosh. So thank you all. I want to honor your time, and we'll carry some questions forward. We'll pick another principle to kind of tackle. But this was, I hope, a good conversation. I enjoyed it, and boy, it's a big topic. But thank you. I heard some really nice, genuine human caring coming to the surface, and recognition of that. So thank you all for being here. As has been our practice, you'll get the recording link, you'll get the chat. And Ashley shared something with me before she had to leave, and I'll go ahead and attach that as well so you guys can see that, just for your information, so you get everything that was in the chat box. So thank you all very much. Take care, stay well. I hope to see you next week.